You're listening to the Genomics Minute, brought to you by Genome British Columbia.
Thank you, Robyn, for joining us. So the first question I have is looking at how Australia is gathering evidence to inform policy as it relates to precision health.
Australia's been gathering evidence around genomic medicine for quite some time now. It's doing this through a number of strategies. It's commissioning research to be done by Australia's research community. It's asking Australia's research community to come up with ideas that might inform the way genomic medicine should be practiced, and it's using the traditional methods of what we call our National Health and Medical Research Council and our ARC Council, and also there's been some special initiatives which have been funded by the Commonwealth and the state government to try and collect this evidence.
And if we maybe take a more specific example, if we think about reimbursement of testing for the public healthcare system, where are you gathering evidence and where do you see the gaps?
To start with the gaps in evidence, it's really around clinical utility. That would be our prime area of missing information, is around where things really have benefit in clinical practice, where they change care, where they improve care. We have a lot of evidence around analytical validity of tests and even clinical validity, but when it comes to actually the impact of that test in clinical practice, there's a real evidence gap. The other area of missing information is around the economic cases for introducing genomics, and often the studies that have been done by researchers have missed out collecting the economic evidence base that supports testing. So they're probably the two big areas, clinical utility and then the economic case, and both of those are obviously interrelated to each other.
Great. Now, changing tack a little bit, what about data privacy in Australia? How is the concept of privacy changing in the Australian context?
There's a number of changes in data privacy. Part of these are driven by the legislation that the Commonwealth has introduced, but that's balanced with an increasing push from the community to make their data available, and that's driven by community groups who, on the one hand, really want to share the information that they have about their own diseases and their own families and their own genomes, even in some cases, whereas on the other hand, there's a greater fear from government around what data and how that data will be used and potentially misused, and their need to protect what they see as a broader public interest around the use of data. So there isn't really a movement in any particular direction of alignment. I think there remains this gap between what government wants to do in terms of regulating and protecting data and the community's desire, which obviously isn't universal, otherwise government wouldn't be reacting in this way, to share data.
That's great. And like Canada, Australia has a publicly funded healthcare system. So, but even with a publicly funded system, barriers persist to equity of access to healthcare, and particularly when you introduce new technologies or new services. So just wanted to speak a little bit about this in an Australian context, whether that's equity of access from different socioeconomic backgrounds, from Indigenous groups, or for people who are in rural areas.
So we know that even though publicly funded healthcare systems seek to provide equitable access to healthcare at their very heart, we know that the uptake of any new reimbursed service is always maldistributed. So we typically see uptake and use of the public funding to those who have a lot of access to resources, and a very slow uptake and sometimes no uptake in people who are disadvantaged. And that maldistribution is obviously not just related to funding, because funding is not the barrier. They could get the service for the same support as a better funded person, but it's really around the knowledge of people in those areas to access, their willingness to uptake the service in the first place, their distance from service providers. It's a huge problem in Australia with a geographically diverse and dispersed population, with vast areas of 5-6 hours in a plane to get to a community means that they just don't know that the service is available. And so it's not just a matter of reimbursement, it's a matter of a whole lot of other interventions to try and get access. There's a lot more telemedicine being introduced at the moment in Australia to try and overcome these barriers. but there's still a lot more work to be done.